I'll be doing my assignment on COVID-19, Ground Zero, excuse the pronunciation, Wuhan, Hebei Province. Now, this is the Chinese government and influence of their strategies and policies to help control COVID-19. But let's start with the background. So on the 31st of December 2019, COVID was first reported in the city of Wuhan. Within 30 days, COVID spread from Wuhan to mainland China, causing extreme damage, but wasn't considered highly contagious until it entered mainland China. Chinese government stepped in to put in place extreme measures to contain the virus. Li Wanglang was the first Wuhan doctor to try and blow the whistle on COVID-19 virus. Unfortunately, his efforts to warn the other doctors was suppressed by authorities. If authorities didn't stop Li Wanglang from blowing the whistle, would there have been a chance to stop COVID-19 spreading globally? Could there have been a chance to avoid millions of deaths? Could the virus been contained within Wuhan? To understand the reasons why, we have to understand the methods that China used to contain the virus. So what were the methods that China's used? Migration methods. So in December 2019, authorities were closely monitoring a cluster of pneumonia cases within Wuhan. In January 23, 2020, Wuhan announced their lockdown and while implementing strong, carriers and controlling measures. For example, slowing of personal travel. Now this had negative effects on social stability, psychological human needs and economical needs. But however, the good thing from this, it did slow down the spread of COVID-19 by 3 to 5 days, and it did result in reduction of gas emissions. But this also brought a new set of challenges economically as well as labour market difficulties. So China government put in place prevention and controlling strategies such as first lockdown, severe surveillance, washing of hands with disinfectant, wearing of masks, complete shutdown, isolation, lockdown of cities, enforcing work from home measures, shutting down schools and colleges and mobility restrictions, and the shutdown of massive construction of hospitals, etc. They also put in further proceedings or procedures to control COVID-19. So in February 2020, authorities started a door-to-door check to round up every affected citizen and conduct compulsory face-to-face tests. Anyone having contact with infected individuals were forced into quarantine for 10 days. They were taken from their homes and put into newly built temporary quarantine centres. Anyone who buys a cough medicine will have to use their ID card so they can be checked by authorities. Potentially this resulted in people feeling helpless and no control over their rights. It also had a breach of privacy as well. So what were the side effects of implementing these strategies? Right, the side effects would be hospitals were overrun and medical staff believed that they had social and professional obligations to continue working for long hours. Now, what this could result in working for long hours is exhausted staff, and more human errors would have been commenced or would have been done. So therefore, it could put a lot of people at risk health-wise if they're not able to concentrate and perform their job at the best of their ability. They were also overworked, anxious regarding their own safety and the safety of their families, as well as suffering from psychological effects from mortality from COVID-19. And what that could have been is also long-term side effects as well, if we look at as well. But that's causing implications for nursing education and clinical practice settings for future pandemics. So say if you were entering into the profession of nursing, this would be one of the things that would turn you off. A pandemic. You're not getting the support you required. You feel an obligation to work long hours. And not only that, is that you're tired and exhausted, and no, you're putting your own safety and your family's safety at risk as well. So medical staff well-being was not taken consideration during COVID-19. Although China was working as quickly as possible to manage the outbreak by running tests on already affected patients. Now this did help understand how the virus spread and help with management of the virus in future. So the weaknesses of China's government strategies were psychological issues, social distress, loss of income, medical staff being overworked, depression, anxiety, insomnia, and distress symptoms. After a survey was conducted on Chinese citizens, it was discovered from COVID-19, depression, anxiety, insomnia, and distress were also increased. This could mean that without documentation to support it, but it could also be that suicide could be actually on the increase due to depression and anxiety increases. Now, they did run a multivariable logistic regression analysis was performed, and they did identify mental health issues. Now, this was especially evident in the Hebei Province area with workers within the area. They suffered the most, and this was due to heavy income losses, and also pregnant women were at high risk of developing unfavourable mental health symptoms, potentially resulting in requiring psychological support or interventions. So whose income was affected the most from government strategies? It was discovered migrant workers, workers from manufacturing, private sector, and families relying on wages and small enterprises were affected the most. This would have been from the closing down of small businesses and employers having to stop trading, therefore employees losing their jobs, potentially causing forced bankruptcy and unemployment. The good thing is China government did step in and once again offered to help vulnerable families in need. Whereas families relying on income from farming or transfer payments were less affected, so they probably needed less help financially, and as that could have been from their trading being done outside of China, and so therefore at this stage COVID hadn't actually maybe not affected the trading as much for them to have a massive loss of income. So did these policies and strategies pay off? Although being the first country to be affected by COVID-19, China was the first to recover from the disaster. It was China's effort which made them stand out to overcome the pandemic. The strong environmental protocol, although could be considered harsh, such as severe surveillance, structured community group, disciplined citizens, was the reason behind China's success. But since the close of Wuhan City on April 8, 2020, local infections have still occurred in various regions, and number of new infections have been controlled below 400. So if you look to the graph to the right of you, you can see in 2020, the first in fluctuation of COVID, infected people were quite high, the number of affected people. And as over a period of time when the government enforced their strategies and policies, you can see the number of infected people slowly declining. Now, as you can see, when you go down to January 2021, that is where it's at its lowest, under 400. So conclusion, China focused resolutely on implementing and preventing control work, aiming to keep the number of infected people to zero. China also focused on strong hierarchy and government mechanisms which guarantee prevention and control. But at what cost do these strategies come at? From the strategy put in place, it basically caused an increase of mental health such as distress, anxiety, psychological issues, depression, and zombie, and potentially it could have increased suicidal rates as well. If we allowed Wing Lang to blow the whistle, would that mean that China would have been able to put these strategies sooner in place and could have potentially contained the virus only to Wuhan? This therefore resulting in less mental stress issues, less hospital staff being overrun and hospitals, and barely any increase from unemployment, loss of jobs, or potential forced bankruptcy of small businesses. So therefore they would be reducing the stress of the economy and their citizens at the same time. However, the good thing about the pandemic did brought out issues relating to government technology, education, as well as public awareness. So this gives an opportunity to government to reassess the policies and procedures, so when if another pandemic comes out, they are well prepared, and then they can, by all means, put the necessary policies and procedures in place as soon as possible. However, in the future though, nursing management and hospital policies need to be ready to adhere to a flexible work planning systems and approaches during the pandemic, thus helping relieve stress from overworked medical staff and ensuring a smooth control of future pandemics, and it also be a more attractive field for future employees to enter into, because it shows that they have control over this sort of situation and they can guarantee and ensure their safety and well-being. And this will also provide better working conditions for the medical staff. So that concludes my presentation today. Here's my references, and thank you very much for your time.